Honourable Senators, I rise to speak for the first time today in this chamber. Thank you. Situated on unceded and unsurrendered Anishinaabe Algonquin territory to address an issue of critical importance, the opioid crisis in Canada. I also wish to recognize the First Nations and Métis people of Treaty 6 territory, the land that has sustained my family for generations. This crisis continues to devastate families and communities across the country, taking lives at an alarming rate. Last week, during National Addictions Awareness Week, we were reminded of the urgency and complexity of this challenge. However, 1 week of awareness is not enough. It is our shared responsibility to confront this crisis with sustained focus and action. The Canadian Research Initiative for Substance Matters, or CRISM, a national research network launched in 2015 and funded by the Canadian Institute of Health Research, has updated its national guidelines for the clinical management of opioid use disorder. These guidelines, published in the Canadian Medical Association Journal on November 12, 2024, reflect 6 years of advancements in science and practice. The updated guidelines recognize methadone and buprenorphine as equally effective first-line treatments and recommend slow-release oral morphine as a second-line option. Importantly, the guidelines caution against relying only on withdrawal management and de-emphasize strictly requiring psychosocial support in order to access first-line treatments, as there is strong evidence that medication alone is equally effective for this particular drug problem. They also stress the need for harm reduction services throughout the continuum of care. CRISM's work is a testament to what evidence-based research can achieve. Their mission to address substance use through leadership, research, and action is saving lives and supporting recovery. Their work serves to enhance the essential role of the dedicated healthcare providers in addiction medicine, such as physicians, nurses, social workers, peer support workers, and others on the front lines of this crisis. In 2023-24, just over 5,500 Saskatchewan residents received such life-saving opioid agonist therapy, providing them with enhanced prospects to strengthen their recovery journey. I congratulate CRISM on their accomplishments and the value they add to supporting those with substance use disorders. As we move forward, I urge this chamber to support solutions grounded in science, but also to acknowledge the interplay of risk factors for substance use disorder, including poverty and systemic racism. Together, we can advance meaningful change. Thank you. Merci. Miigwech.